Hello, Salt Lake City. As each of us continue to make sacrifices to keep our families, friends, and our communities healthy, many are wondering how we're going to get through the challenges that COVID will present through the remainder of this pandemic. While our city continues its work on equity, police reform, and other major initiatives, I want to focus right now with you on our winter plans for COVID and how we'll get through this together. When the COVID-19 pandemic created a state of emergency in Salt Lake City in March, we spent the following months moving from one new crisis to the next, navigating unprecedented uncertainty by responding to needs as we discovered them. But after living with the realities of COVID-19 for 6 months and facing the reality that it will be many months before we have a vaccine, we want you to know that your city is committed to helping you weather this generational storm. The COVID-19 winter plan I'm sharing with you right now focuses on the challenges you've been living with every day and aims to mitigate the complexities that are yet to come. Knowing how this virus has impacted the economic and social structures that form the underpinning of every resident's daily life, we focused our planning on 5 key areas that address the challenges COVID will create for our city's residents this winter: health, education and childcare, economic support, housing stability and homeless services, and operations and service from the city. My number one priority this winter is your health. My team works closely with the county health department and the state to monitor data and make sure that Salt Lake City's COVID-19 trends are headed in the right direction. I'm heartened by the fact that our city has seen stable and declining trends for more than 30 days. Thank you for taking the mask mandate seriously. It is working. 2 key factors in maintaining our city's health this winter are access to testing and access to personal protective equipment, commonly called PPE. These are essential tools. They play a fundamental role in virus prevention, and we're grateful to Salt Lake County for expanding testing in some of our most highly impacted areas. But we have a responsibility to do more. Recently, I put forward a budget proposal that will send $200,000 to 2 organizations that provide care to some of our most vulnerable residents: the Association for Utah Community Health and the 4th Street Clinic. AUCH does extensive community outreach and provides all kinds of support for residents who've been impacted by COVID-19. Community health centers provide care for those who might not otherwise have access to it, and assist COVID patients throughout their illness with services that range from prescription filling to diapers to rental assistance. The need for this care is great, and this budget allocation will make a real difference in people's lives. The 4th Street Clinic, which is the only access to health care for many of our residents who are experiencing homelessness, has had to make significant modifications to operate during COVID, and my proposal will help keep this clinic running safely through the winter. I know that one thing that stays on my mind, just as I'm sure it does yours, is the vaccination for this disease. While we don't know exactly when it will be here, we've got to be ready when it's time to stand up that operation. This winter is the right time to make that plan and solidify how we'll communicate and provide access to a COVID-19 vaccine. Salt Lake City has already started coordinating with the healthcare providers on these measures. Because the day a vaccination becomes widely available, I want our residents to understand the importance of getting vaccinated and have a quick and streamlined access to it. One of the biggest challenges facing families in our city today is education and childcare. Our city's parents are balancing their own workloads with the schooling and care of their children. And as any parent or caregiver will tell you, keeping a job, parenting every minute of the day, making sure the kids are getting their education, and keeping everyone physically and mentally healthy has been an absolute challenge during this pandemic. Looking at the coming months until a vaccine, this winter will be very hard on many families. As a city, we must have their backs. Last week, I announced a budget proposal to our City Council that included $1.6 million in funding to dramatically increase our youth city programs for this school year. This expansion would be life-changing for many city families by filling the childcare, educational support, and social service gaps that have been created by COVID-19. It would allow the program to stand up additional locations, expand its hours, and add programming to meet the increased needs of the kids and their parents in the months ahead. Also included in my budget proposal is funding to bridge the digital divide in our city. Access to the internet has long been a fundamental need for our people. It's how our kids participate in school. It's how we pay the bills, register to vote, take the census, and more. And that is all before COVID, which severely limited the ability of our city's residents to access free Wi-Fi at our libraries or other community centers. What my administration has proposed will allow the city to create, for the first time, the backbone for a Wi-Fi system on Ensign Peak. This infrastructure will provide a multi-point solution for public Wi-Fi and provide greater connection in areas of the city experiencing digital inequity. A system like this could be the difference in a homework assignment getting turned in on time, a bill getting paid, a job application being submitted, or a doctor's appointment getting scheduled. We want people to have easier, more convenient access to the internet, not because it's a luxury, but because it's an essential utility to live in today's society. And this is the first step toward us reaching that goal. These two budget allocations would be game changers for some of our Salt Lake City parents as they navigate the difficult path of online schooling and after-school childcare this winter, and we owe it to them to help lighten their load. Our third area of focus is economic support for our businesses and the revitalization of our economy. It's challenging to start or run a business under normal circumstances, and COVID-19 has only compounded these difficulties for many promising entrepreneurs and long-beloved businesses in our city. One of our first steps is our work on a broad update to our Economic Development Loan Fund program to include microloans, a mitigation fund for businesses impacted by construction projects, and strategic resources for small businesses. This pandemic has uniquely challenged businesses to be transparent with workplace safety. People want and deserve to feel safe going to work, and they want to feel safe going to get a haircut or picking up a to-go order at their favorite restaurant. Personal protective equipment is a key component in a business's ability to successfully illustrate their safety consciousness. And I will propose to the City Council that we allocate part of any additional CARES funding we receive to make it easier for the business community to access PPE through upfront grants. We also know that COVID-19 has more severely impacted our communities of color, and those impacts include greater economic and financial instability. Our city wants to do more for our diverse businesses during this challenging time and beyond, starting first with providing cultural and language liaisons to assist new businesses with the city's permitting and licensing process. And second, I propose funding for a city partnership with the Suazo Center, which I believe will help us to deepen our connection with Spanish-speaking business owners and allow us to better tailor to them the city resources they need. Salt Lake City businesses bring character, quality of life, and diversity to our city. They are an integral part of our neighborhood character, and we owe it to them to offer new and innovative systems of support for this winter. With many Americans just one paycheck away from homelessness, housing stability and homeless services are an absolutely critical component of this plan. Salt Lake City is invested in helping its residents keep a roof over their heads this winter. And to help us do that, we've identified a $9 million housing stability package that will be used to facilitate mortgage, rental, and rapid rehousing assistance. The first $1.1 million of this program was targeted specifically to the 2 zip codes in our city that have been most impacted by COVID-19. We've also launched an effort to raise $1 million to help residents who did not qualify for or couldn't access federal stimulus money. Raise Up SLC will provide financial relief to residents in the form of a no-fee debit card, which they can use on a variety of living essentials, including rental or mortgage payments, and you can donate any amount quickly and securely by texting GIVE SLC to 21,000. Homelessness may be the most poignant and painful issue in our city today. Some of our most vulnerable residents were made even more vulnerable as COVID-19 impacted our homeless resource centers in the system, access to services, and places to go during the day to escape from the weather. The result has been a visible increase in the number of individuals who are suffering on the street right now, and neighborhoods and businesses who have been seriously impacted. Though homelessness is a statewide issue that requires every level of government to fully engage. As the capital city, we know that Salt Lake City will always be the nexus of services and opportunities for individuals experiencing homelessness. To address the current escalated homelessness crisis on our streets, we are working hard. I'm excited to announce that my administration is building, with the support of the City Council, a two-phase community commitment program. Phase 1 will entail a 12-week enhanced neighborhood cleaning program that will ease the impacts of homelessness on both the unsheltered homeless and the neighborhoods by providing regular cleaning of bio-waste and garbage, accompanied by provider outreach to connect people with the services they need. Phase 2 will focus on outreach by our Community Connection Center social workers, service providers, legal defenders, and the Justice Court to encourage people to take care of outstanding warrants and access treatment or temporary housing. As we prepare for another winter, our city will continue doing all we can to ensure that homelessness is rare, brief, and non-recurring. We've allocated over $15 million each year over recent years toward providing homeless services in our city through grants to service providers, investments in our homeless engagement and response team, emergency response, and cleanup of our city streets. In January 2020, just 17 days after I was sworn in as your mayor, Salt Lake City opened a city-owned location for an emergency winter overflow shelter. And today, we're working once again with Salt Lake County and the Salt Lake Valley Coalition to End Homelessness to have a plan in place for homeless services and shelter this winter. I've also proposed a budget amendment that would put an additional $150,000 toward the work of the 4th Street Clinic to serve Salt Lake City's homeless population with COVID testing and medical services over the coming winter months, and which I call upon the City Council to support so that we can give proper and consistent care to people experiencing homelessness this winter. The final piece of our winter COVID plan that I want to share with you is about our city operations and services. With the right planning and procedures in place, we're confident in our ability to provide you with the services you rely on daily throughout this winter. Our team has developed a Readiness Actions Modification Plan, which is the framework we will use across city operations to evaluate best health and safety practices for the Salt Lake City workforce. We also want to make it easier for all Salt Lake City residents to access city services this winter. We will continue to adapt to meet your needs, from appropriate levels of public interaction in city buildings to providing better multilingual access for every city service, to better ways of being civically engaged and interacting with elected officials. We would not be the resilient and innovative city that we are without the incredible dedication of our city employees. These past 8 months have been difficult as we've navigated an earthquake, a pandemic, and made dozens of adaptations to the way our city works. Many of our employees don't have the option to work from home. They're the people who keep all your vital city services going each and every day. I want to take a minute to recognize 11 employees who have demonstrated stellar leadership throughout these challenges. These employees have worked particularly hard to be innovators and motivators among their peers. Supreet Gill, Food and Equity Advisor in the Sustainability Department. Jorge Chamorro, Compliance Division Director. Heidi Medrano, Legal Assistant. Patrick Merschdorf, Firefighter. Roberta Reichgelt, Head of Small Business Outreach. Mike Ditolla, Police Officer. Kim Thomas, Division of Child and Family Services Director. Wes Ing, Public Utilities Safety Manager. Lonnie Egertson-Goff, Housing and Neighborhood Development. Patrick Staker, Parks Division, and John Flint in Emergency Management. In the course of their work, each individual on this list has gone above and beyond during these extraordinary times, and we wouldn't be the city we are without them. Salt Lake City, you are resilient, innovative, and caring. We are facing a most challenging time, yes, but your city has your back. And we're going to do everything in our power to make the road ahead a little easier. I send you my sincere gratitude and care. Be well.